I feel like mental health is such a serious topic, just like we were sharing with you before, Doc.
What is mental health? Ukisikia to the term mental health, what is it?
Political instability.
Can I diagnose myself with a mental condition?
That's it. Yo.
Knowledge also has to be good, but also how we use it also can make us either take medication or not take medication, go for help or not go for help.
Hey guys, welcome back to yet another episode of Space Yako the podcast. In studio today we have a guest expert, Dr. Malaika, and we're going to converse about mental health. So she is based at Tranquil Medical Center at Karen in Nairobi, and maybe I'll give her this opportunity to introduce herself. We also have our co-hosts with us. Maybe they should go first. Tena Dr. Malaika will follow next.
Hi guys, I'm Merlyne.
Hello, naitwa Shiko.
Yes, Dr. Malaika, how are you feeling?
Good. My name is Dr. Malaika. I am a psychiatrist. Happy to be here. And just to get the ball rolling, a psychiatrist, just for us to get this out of the way, is a doctor specialized in mental health. The same way someone can be a doctor specialized in pediatrics, which is child care, or women care, which is OBGYN, or a physician who takes care of hypertension, diabetes. So psychiatrist is a doctor specialized in mental health. So we assess, diagnose, treat mental health conditions.
Wow. So for how long have you been in the profession?
Coming up to 3 years now.
3 years?
Yes.
Wow.
As a psychiatrist. Yeah.
That's lovely. So if you're watching us on YouTube, ensure that you do subscribe. Leave us some comments down below. If you're watching us from Spotify, also listen to us. Thank you so much. You can also find us on our website at Wazzii, which is wazzii.ke. Please feel free to interact with our chatbot. So we have Merlyne with our Space Spice for this episode. So Merlyne, tuambie Space Spice ya leo.
So maybe just a disclaimer. I feel like mental health is such a serious topic, just like we were sharing with you before, Doc. And I just hope that in between the conversation, we are not experts. So if there is at all any kind of, because we understand there's language in every field, and there is the language we are used to when talking about mental health. For example, the M word, I won't mention it now that you told us that is kind of offensive, yeah? So at whatever point, especially me, when I say anything, and it's not professional like, but that can be intimidating to someone, I'm really up for correction. Yeah. So our Space Spice today, karibu niseme by Gladwell. It's from JAMA Internal Medicine by Goyal. So this is what it says. It says research shows that practicing mindfulness, meditation, and can significantly reduce symptoms of anxiety and depression. Just a few minutes a day of mindful breathing or meditation can improve mental well-being and enhance emotional regulation.
Wow.
Yeah.
Mmesikia Space Spice ya leo.
Yeah.
So research shows kwamba your anxiety na depression ni kama imekuwa kutoka kitambo. Si eti ni vitu ambazo zimeanza ku come up during this age. People have been suffering through getting depression, getting anxious na vitu kama hizo. And today we're going to look deeper into that, and we have an expert with us ambaye ataweza clarify most of the questions that we do have, si ndio? So nikianzia na mental health. What is mental health? Ukisikia to the term mental health, what is it, and how different is it from physical health? Manake najua tushazoea kuwa na like a lot of tuseme physical ailments. Uko hapo nasema, I have a stomach ache, mara naumwa na kichwa. That is the physical aspect of the physical health, si ndio? But what is mental health? What is mental health, Aisha?
Mental health, it's how we think, how we feel, right? How we think, how we
it's
feel.
mental, cognitive.
Yeah.
so the emotion side of things as well. Yeah, and ambayo inaweza kuwa affected na so many things, from even the environment that we're in, political instability.
Yeah.
Yeah, social issues as well. Yeah.
Merlyne?
Everything she said plus everything else. It's like mental health is general well-being. So because I understand that everything we do is kind of influenced by our mind,
Yeah.
whether it's like moving a finger, doing what. So I feel like mental health is general well-being. Yeah.
Of a
Yes.
person.
Dr. Malaika.
Yeah.
Are we wrong?
So no. She's right on the money. Actually, mental health encompasses things like our thoughts, which then affect our feelings,
Yeah.
and then that affects our behavior. What people see outwards is because of what's happening inside. So how you feel, I'm thinking good thoughts, I'm thinking positive thoughts, then I feel good, I feel happy, and then I will act that. So also the negative, the opposite of that is quite true. So if I'm having bad thoughts about myself, low self-esteem, tuanipendi, and then I will feel bad about myself, about my environment, and then I will behave in a way that makes people know that. Eventually, yani, I may withdraw from people, I may sleep too much, spend time alone, or end up in self-destructive behavior to make myself feel good because I think everyone else around me doesn't like me anymore.
Yeah. Okay, so in mental health, definitely kuna issues ambazo youth are facing.
Yeah.
And I'd like to think these issues zina affect their behavior, the way you've just said. And we need to address them. We need to know how to either cope with the mental health issues that we are facing and how we interact with people ambao kona this mental kind of issues, sindio? So what are those kinds of issues ambazo mnazijua ambazo ni mental? What have you heard of? Apart from, mi najua about anxiety, najua about depression, najua about maybe post-traumatic stress disorder, which is abbreviated as PTSD.
PTSD.
Yeah.
Which other mental health issues mnajua ambazo maybe youth face or you've heard of ama mmesikia kwa movie?
Stress, eating disorders, insomnia, right?
Right, yeah.
Kuna zingine ama tushakava kaa zote hapo, sindio?
I think most.
Okay, haya. So, okay. Ni mingi. Twende tu pole pole. Dr. Malaika niko na swali. So, kwa hizi mental health issues, we do know that kuna people who deal with them na wana struggle sana to the point that they do need to go see somebody and seek professional help.
Yeah.
So kwanza hata before tuanze kudive into the mental health issues, my question is, what's the difference between a psychologist, a psychiatrist, a therapist na a counselor?
Okay.
Wote wanafanya the same kind of work wakisaidia mtu ambaye ana suffer na hizo conditions ama
no.
health issues?
Not necessarily, but we all work together. Yeah. So a psychiatrist is a doctor. So a doctor means the person had the first degree in medicine and then became a doctor. They need a further degree now to become a psychiatrist. So they're able to assess, diagnose, and then even prescribe medication. That's a psychiatrist. Then the next one is a psychologist. So their background is in psychology, which is the study of human behavior. So theirs is helping you find behavioral ways of coping with if it's an anxiety disorder or addiction disorder. So they help you find ways of changing your behavior and learning new behavior of how to cope in the environment. And normally, psychologists work with psychiatrists very closely. They're also called therapists. It's another, they can also be called therapy because they give psychotherapy, so they're called therapists.
Yeah.
Then there are counselors. Counselors are more, have a background in counseling, which is more of providing guidance. So perhaps you're going through a stressful situation, they might guide you through it. Come a stressful marriage, stressful school environment, stressful work environment. They may help you, give you ideas on how to navigate that. So of those two, therapists, psychologists, counselors, none can prescribe medication, but they help you through that journey. And ideally, all of us are supposed to know what we call a DSM. DSM is a manual that is used all over the world to diagnose mental health conditions. So whether you're in China, India, Tanzania, or Timbuktu, all of us use that same manual all over the world to tell us now this one meets criteria for depression, this is anxiety, this is psychosis, this is schizophrenia, addiction. And then that way now, whether you're being managed here and then you move to China, the doctor there can just continue from there because it's the same manual. So all of us should know that manual, but unfortunately most of us, rather some people in that field, especially counselors, may not exactly know all that, which is something that we're trying to get there. But in answer to your question, psychiatrists, psychologists, counselors, we work together. And ideally, a psychologist would know that huyu pastor nimefika na huyu hapa, let me refer to a psychiatrist.
Okay.
And also vice versa. I'm a psychiatrist, maybe I don't know how to manage this person. Let me refer them to a psychologist, then we can work together. I offer the medication, and then they offer the behavioral changing therapies. So we should work together.
So hiyo kwa sababu ya people who don't understand, hiyo manual ambayo umesema DSM inamaanisha nini?
So it means it's called DSM, which is a Diagnostic Statistical Manual, DSM, that has all the mental health conditions in the world that have been researched and how the criteria on how to diagnose based on this criteria, then this is this, based on this, it is this. So that's why if I was to go to America, they will still say have depression, because even in Africa, it's the same. They use the same criteria to say that you have depression, and then therefore you manage it based on what has been recommended.
Okay.
Yeah.
Is that manual by any chance just found online? Is it something that naweza tafuta tu nipate mwenyewe?
Yes, it is available. Currently, it's in its 5th edition. It's called DSM-5 now. So you can just Google DSM-5 and it will show you. It's a manual, so it has a lot of things you're looking to find.
And now, because you're also talking about that a minute, can I diagnose myself with a mental condition? If I go through the manual, then I feel like probably some of the symptoms that I do have ziko similar to whatever the manual is saying. Can I tell myself that, okay, Gladwell, according to your own diagnosis, uko na ADHD?
Well, anything is possible. I mean, if you're to Google right now and check what is the normal blood pressure, it will tell you it's whatever numbers they are. Then you'd go and check at your clinic and say it's high, and then you'd say, yeah, niko na pressure. But then from there, what next? So you have the information, and then what next now?
Okay.
So you can go. People always Google and say, I have this condition, I have anxiety. They always come and say, I think I have this condition, I think I have this, which is good because you have information, which is power, So as long as once you know yourself, excellent. Now we continue from there. What next? Yeah, but it's always good for us, for people to understand their diagnosis if they have one. So if you want to go and Google, you should do that. You should go and check and see what it is you think you have. But then don't take it as gospel truth. Then go and see a professional and ask them, I think I have this.
Okay.
What do you think based on that? Because we base it on history. So what you tell me, what your mom tells me about you, what your boyfriend, whoever is closest to you has known you for the longest, I ask them also history to get to understand you from their perspective. Because sometimes our behaviors, things we do, some things we don't even know we're doing them, but people are watching us and seeing that, akuna shida, kuna kitu hapa nafanya, ikieleweki. Yeah. So it's always good to have power, have information, but then go see someone else to cross-check, to verify, and then to go to the next step.
Yeah, I want to ask what I wanted to ask before imepotea, but you've said for you to diagnose someone, you have to check with the people who are immediate to that person. Does it mean that ideally, is there cases where you can't diagnose unless you find those people and talk to?
Well, it does become a bit tricky, because mental health, unlike physical health, physical health, someone has high sugars, you do a blood test, RBS, it's high. Okay, high sugars. You do HbA1c, it's been high for the last 3 months. So this confirms it. For mental health, it's based on behavior. What have they observed, and for how long? Yeah. So you may not. Also, another thing about this thing that we deal with is that sometimes you have what we call, you lack insight. Insight means not knowing you have a problem. So you may think you're acting
normal,
typical for yourself, but kumbe, after the last 6 months, you may deviate from your usual behaviors to now different behaviors that are not in keeping with your family rules and regulations, or your company regulations, or the world as we would like to think. So so it's always good for us to hear from your wife, your husband, your mother, your father, your best friend, whoever it is, to hear also from them how long has it been since they've noticed a change in you, and what have they noticed. Yeah. But other than that, you come and tell me I think I have ABCD. I won't say that I won't believe you. It's not about belief or anything. It just helps me solidify that enyewe ini hii. Yeah.
And in the case, in the event that a person doesn't have immediate family members, say we're talking about either an orphan or a person who stays lives by the streets. Unajua ni mtu ambaye hautapata like tangible people ambao utamlink to such persons. So how will you be able to tell if you're not able to get the people?
In many cases, there's always someone. It may not be a family member by blood, but there's a neighbor who has watched this person for the longest, or for the last 1 week. But also kama hakuna, si ni hivyo tu. We just
Sio
do the
dependent.
best. No, it's not. It's always good, but it's not a deal breaker. It just makes it much easier once you have someone who can collaborate the history, so we understand you better.
Okay. Yeah. I hope our audience is following. Tusko tumeingia sana alafu umepotea. So in case you have any queries, again, go to our chat bot, which is wazzii.ke, and inquire, ask questions. Kwa episode, comment down below in case you want like an episode of the same, because this is just an overview. Tunaanzia, so we're just starting off. I hope you're following. Haya, so tukiendelea kwa hizi mental health issues, are they contracted? Are they genetic? Like, how do you come about unapata ukona a mental health condition?
Yeah, contracted.
They're contracted.
That makes me think of scabies. Scabies is contracted. If I touch you and you have scabies, you
Scabies are my rabies.
Scabies. Rabies is dog, eh?
Yeah.
Scabies is the other one of joints huku unasikia unawasha,
okay.
And rashes all over.
Yes, and rashes all over. So it's not like a skin issue whereby if I touch you, then again I get chicken pox. I think it was like that. But for mental health conditions, it's just like physical health conditions. If your family member or your mother or your father, who's your first degree relative, has a mental health condition, you as a child of that house has a higher chance compared to somebody of the next house who doesn't have a family member with that mental illness to getting that illness. Doesn't mean it's a sure bet that watapata, but chance iko higher compared to mtu ambaye hana hiyo history. So genetically, there's that predisposition that one is predisposed to. Lakini licha ya genetics, pia kuna environment. So you can, and most of the times it is how we interact with genes and the environment. So mtu ambaye kwa mfano parents wake wana mental health condition, mzazi wake mmoja ana mental health condition, yes, so kama atakuwa nayo, no, it just means they have a higher chance. Supposing they're in an environment where they are exposed to alcohol, they go through trauma of any kind, whether it's physical trauma, sexual trauma, or neglect of any kind, then if you combine the genes, that environment that they've been exposed to as early as early childhood, then they have a higher chance then of getting this illness, of it manifesting. So sio kama ni sure bet, but still ni environment and genes. But even with the environment and genes interacting and then giving you a higher chance, maybe because of something called resilience, you still don't get it. So sio kwamba because of the environment and the genes you're going to get it, but you have a higher chance. But then if you do things like you avoid substance use, you try to manage your stress levels well, you do exercise, you sort of minimize your chances of getting your parents or your genetic predisposed mental health condition. Yeah.
Okay. Is it a misconception that most of these genetic kinds of conditions ambazo watu hupata zinakwanga zile zinapatwa na watu wazee? I'll look at a condition like schizophrenia. I feel like schizophrenia and dementia zinakwanga mostly na watu wazee. Ama?
So schizophrenia and dementia. So schizophrenia is a psychotic condition that can occur at any age to anyone. Yeah. However, most times it is not often found in children, but it normally tends to start towards the late teens, early 20s, especially for boys and for men, and then for girls it typically occurs towards late 20s. 30s, yeah. But of course, it can occur at any age. But the typical time is late teens, 20s, and then late 20s for girls to 30s. Yeah. So you're still young.
Yeah,
so dementia ni ambayo sa inaokaa above the age of 65. Okay, 55, from 55 onwards you have a higher chance, 65 even higher, 75 higher. Of course, magonjwa ambayo tuseme magonjwa uzeeni ambayo characterize mostly na memory problems that can also come along with behavioral disturbances. So somebody might be start seeing things, hearing things that are not in keeping with reality. Now that is dementia, uzeeni. But schizophrenia is a type of psychotic condition. Psychosis meaning it's out of touch with reality. So mtu ambaye kwa mfano anasikia sauti, you're hearing voices no one else is hearing around you, you're seeing things mwenzako hawavioni, you're having firm and fixed false beliefs ambazo hata ukiambiwa nini yani unaendelea kushikilia tu kwamba ni mimi ni for mimi I am Jesus, or I know Ruto, or I know the president, or I am a multimillionaire, even though in reality it's not there. And no matter what your mother, your sister, your wife tells you, huamini. You are stuck kwamba mimi na hivi vitu ambavyo nasema ni vya kweli. Even what I'm hearing is really true to in keeping with my reality. So that is schizophrenia.
So kabla hujaendelea, guys, have you watched that series on Netflix? It's called Baby Reindeer.
Yeah, I watched it.
You've watched it?
Yes,
So kama huyo mwanamke, si ndio?
Yeah, alikuwa na shida.
She used to say, I'm a lawyer.
Oh yeah, I remember that.
I'm a
Was it true?
No.
Oh, okay, sorry. Maybe
You don't remember alikuwa anakaa kwa ile nyumba ile ndogo, and there's nothing she used to do.
in the project, yes.
Just if you've seen the phrase hang my curtains, I wanted to hang my curtains. Just know it's from Baby Reindeer. Yeah.
It's
a good
I don't relate.
It's a very good watch.
Let me ask. You've mentioned something about someone in that's schizophrenia. That one. What is the difference between that and hallucination? Because also hallucination is believing things, seeing things, and all that.
Yeah. So schizophrenia is like saying, okay, it's like infections. Infections kuna aina nyingi. You can have bacterial infection, viral infection, fungal infection, yeah. Then you can have, now in mental health, you can have psychosis. Psychosis now is like infection. It's a broad term that can include now schizophrenia. So for you to have psychosis, you must meet some criteria. Again, that DSM book I was talking about. So the criteria says you must have at least hallucinations. These are false perceptions. We have 5 sense of perception. Yeah, we have our sight, our hearing, touch, taste, afya kunusa. The fifth one. Yeah. So when you have a hallucination, it's a false perception. So you're perceiving a voice. So you're hearing something, or you're perceiving sight. You're seeing something mwenzako haoni, or you're tasting kitu ambacho hakipo, or you are so it's the 5 senses. You're feeling something is touching you, na kipo. That's hallucination. So it's to do with your perceptions that are not there. So we're all seated here. It's quiet right now. But then you're hearing, okay, I'm not talking, but then if I was not talking, but you're hearing a voice. So hiyo haipo, lakini unasikia. That's a hallucination. A false perception of, perceiving of a stimuli that isn't there. That's to have psychosis, must first have hallucinations kwanza. Ya pili ni delusions. Sasa hizo ni
Delulu.
Yes. So delusions are firm and fixed beliefs. So do you kwamba unaamini kwamba mimi I am Jesus, for example, or I am God, or I am a millionaire, or I am Mother Mary, or I know big people, I know people, I those kind of things. So you have someone is following me, someone wants to poison me, someone wants to kill me. So you have delusions that are not in keeping with your cultural context. Yeah. So kwenu, you're regular people, but you think people are following you, your phone is tracked.
Why are you trying to... That one.
Yeah.
Sasa, wajua wanasema, if you want to manifest things in life, you have to say. And your words of affirmation. You have to say them and you have to believe. Sasa, where do you draw the line between manifesting and being delusional?
Yeah. So, well, when you're manifesting, you already know sina. sindio? Unajua kama I don't have, but I'm hoping that at some point in future nitapata hivi vitu. Lakini when you're having a psychotic issue and you're having delusions, hapa where I am right now, mitari nayo. I am that person. I am Jesus. I am Joseph. I am already that thing, you know. And it's not like in the future. It's now, and no matter what I tell you, you are completely convinced that is what is happening to you, and that's your reality right now.
Oh yeah.
Lakini manifesting ni hapa.
Lakini manifesting, you already know kwamba si nategemea natarajia in the future kwamba nikiendelea kwa farm kumanifest and to work on this particular goal, nitapata. So you know, as in your reality, you're here, you know kabisa mimi sasa hivi hapa hela naweza shilingi 2. You know that I have in my pocket. Lakini kesho inawezekana kwamba nitapata nini? Hiyo 200,000. Unaona? So you know hauna sasa hivi, lakini you're hoping that utapata with time. As opposed to when you're having this episode, right now, it's right now. My reality right now is my reality. The which I am this person. I am hearing these voices. I am, so you're out of touch with reality.
Yeah, I'm getting that difference. Nimeona kwamba kuna like the meaning of delusion in terms of mental health. Nasa yetu, the Gen Z beat inakwanga mostly us romanticizing the fantasy. Because unaona venye Paul said delulu is the solulu. I know all the Gen Zs ama kila mtu at this point may come across that phrase. And at that point hata tukisema ama nikiji self-proclaim as a delusional person, sijai ifikiria in the light that niyo ya ati I am Mary, I am Mother Mary, I am Jesus. Ni ile tu tuna romanticize the fantasy like I'll get this guy, he loves me, anakata kushika simu yangu cause anataka like ako busy but a pick you get like yetu ilikuwa a bit different. Anyway, mimi nikiwa high school kulikuwa na set book fulani tulikuwa tunasoma, ilikuwa inaitwa Stones Bounce on Water. Memories Lost. Si ulifanya set book?
Memories Lost.
Yeah. Okay, ilikuwanga like na short stories. So hapo kwa the short stories kulikuwa na one story ambayo nilisikilizia like schizophrenia for the first time. And okay. Actually kulikuwa na stories mbili. Kulikuwa na moja the person who was schizophrenic, and it was actually a girl who was young. Ndata nimekuja nikakumbuka like kumbe it's not really associated na people who are like older in terms of age. So kuna that bit. Na bado the other part ya borderline personality, there was also another story. Yeah, there was some crime that happened. Mtu ameuliwa, then they were trying to like know ni nani huyo ameua nani, and then it was all I don't know. Misji kama kuna mtu unajua na feel it's coming back to me say after tumetoka kwa kuongelelea some stories hapa, then I'm like yo, this thing is actually deep. It's deeper than I thought. But anyway, tuko hapa na expert, tuendelea.
So, if I may ask, we've got into the conversation of starting to unpack the disorders without really getting to like boarding our audience on at what point do you start suspecting something is wrong. Alafu iyo, the manual you said is called?
DSM.
Yeah, the DSM. It's used with people from all backgrounds. It's like saying, okay, this will be really bad. Stress ya mtu wako Islando ni the same na stress ya mtu mwenye ako maju. Okay, you didn't get that. But what I'm trying to say is...
I've understood the question. Kwamba, yani, because stress ya Islando na stress ya maju, you think it's different.
Yeah.
Sindio, eh? So basically this book cuts across all nationalities or backgrounds, but of course there's need for you to understand the cultural context of a people. For example, here in Kenya we don't typically worship animals to be our gods. So if I started doing that, worshiping a dog, a cow, that would be not in keeping with my cultural background. But if I went to Asia, for example, and they say that in Asia people tend to worship animals. So in that context, if someone was to do that there, we would say it's a delusion, because most people in that culture have that belief. You get it?
Yeah.
So you used to have to be very keen on the people's cultural context as well, even as you're diagnosing and saying mtu amekaa Kenya, amekaa America, huyu akona hii condition. You must bear in mind someone's cultural context as well.
Okay. Yeah. So my question to that is that we all have I know most of the people with mental health disorders, they have there's this word, Jesus, mbona inapotea. It's like denial, yeah? It's like a denial phase. So I want to understand like the degrees of these disorders, like kuna stress, which is almost the same na, if I'm not wrong, depression. So what is the degree of stress that graduates to depression? Alafu, at what point? Because like you're saying, me, I might think that I'm acting normal and everything is okay with me, but at what point should an individual have that urge to like go in for checkup? Anyone can just go in for checkup for mental health disorders.
Okay. So stress is not a disorder because we all have stress. Stress is all around us. Yeah. So it can lead to a disorder if it becomes overwhelming, and then now you're unable to eat well, you're not sleeping well, you're not able to keep up with your schoolwork or your home or your work. I mean your work. You're withdrawing from people, from friends. You are not as you used to go out in. Now you no longer go out. You used to like watch TV. You no longer watch TV anymore. You used to go and play pool or whatever it is you play. You're no longer doing it anymore. So it has impaired your quality of life. So imeanza kama stress ndio, lakini with time inazidi sasa ina build up, sasa inakuwa kitu kingine ambacho sasa kinahitaji sasa usaidizi. But first of all, stress is a normal thing, and anybody can have stress, and it's just really about how to manage stress so it's overwhelmed. And then what you talk about when you talk about denial, we mean this word called insight. Insight means me being aware that I have a problem, that this problem has a solution, and that is from a therapist or from a doctor. So many guys sometimes in the context of mental health conditions, they don't have insight. For example, in addiction, someone may be inside is inside an addiction to alcohol, for example, or weed. It's affecting their school performance, affecting their finances, their relationships, affecting their health, their physical health. Lakini yeye mwenyewe haoni kama ni mbaya kiasi hicho, you know. So they always say, nikiamua kuacha, I can just stop if I want to stop. But actually, hawezi kuacha mwenyewe. You know, so they lack that kwamba mimi nina shida hii ndio solution yangu. Let me go and see someone. Yeah, so mara nyingi inabidi sasa mtu aletwe. Ama kama mtu ana psychosis, so haiko anymore in reality. Kwa hiyo yeye mwenyewe haoni kamba whatever he's doing or he's believing is not in keeping with reality. Kwa hiyo yeye hali anawoga, haogi, ni mchafu all the time, lakini haoni kwamba kuna shida. So mpaka saa mke wake, mama yake ama mtu wake anamleta. Hana lack your insight. But now for things like depression, for anxiety, mara nyingi mwenyewe mtu anajiona kwamba hii imenilemea. I'm not sleeping, I'm not eating, I'm not productive, I'm always worried, I'm constantly afraid. Let me take myself. So these things like depression, anxiety, mara nyingi you have the ability to be aware of yourself. So unajipeleka. But others, kama sasa hizo psychosis, addictions, mwenyewe hujajiona hivyo, so someone has to take you in, and most times actually it's even a fight na yani mpaka you get someone, you sort of have to almost not use force but like take them against their will, you know, because they lack that thing called insight. It's not necessarily denial, it's more of lack of insight. Yes.
Now that we're already, you've touched on anxiety and depression. Aside from stress, anxiety and depression are the other kinds of conditions ama issues that the youth go through. So ningependa kwanza tujue the difference between the two terminologies, between anxiety and depression. In my opinion, na feeling ni kama anxiety is more of something that is short term. In the sense that tunaangalia just a state of someone being uneasy hivyo, but then depression according to me ni tseme uchukue ma anxiety mingi ucombine hivi, then zikue mingi, then zikue overwhelming, ndo zitakufanya ukue depressed. Then being depressed inakuanga something that is kidogo long term. I feel like it's easier for you to get yourself off from anxiety, but depression inaweza kumaliza. So nafikiria when you're depressed, you need to go see a psychiatrist, you need to go see a psychologist. But if you're anxious, it's something that you can easily get out of. Or inafaa kwaje?
So anxiety is a normal human reaction. Everybody gets anxious because there's an exam coming, it's end month, and rent is due and things are not where it's supposed to be. Kuna interview, so for that, between now and that interview, na wasiwasi, how will it go? How will I prepare myself? The interview happens, then I'm now free. Your anxiety sasa imeisha because it was based on this particular thing that was I'm not sure how it's going to go. That's anxiety, which is a normal human reaction. But now that one can that feeling that you have before an exam, before an interview, before something that's going to happen, as in something that's a big thing happening in your life. Now those feelings can occur throughout. Hamna mtihani, hamna interview, hamna nini, but wewe uko in a constant state of anxiety. Now that is not normal. It's normal to have anxiety before presentation, before whatever. Lakini once iko tu free mchana usiku, anytime tu uko always tense, that now becomes an abnormal disorder. What we call a disorder. Yeah. So in that case, it impairs your functionality, your quality of life. Huwezi kulala, huli vizuri, So once it starts impairing your sleeping, your eating, and your productivity, then it's a problem. Then you need to see someone about it. Yeah. And that's anxiety. Now for depression, many people think that depression it's a term that is commonly used to mean all manner of mental health conditions. If you sit in a doctor's office, you'd hear, huyo alikuwa tuna depression. Sorry. And then ukisikia, alikuwa how were they? Utasikia, alikuwa hivi, alikuwa aogi, alikuwa anaongea mwenyewe. So that is not depression. Depression ni, it's a period of at least 2 weeks minimum where somebody is constantly, most of the time, feeling sad about anything and nothing. They're feeling sad. They're feeling hopeless about life. They are either eating too much or too little, either sleeping too much or too little. They're unable to focus on their work and be productive. They have thoughts of guilt about things that they did or didn't do, maybe even irrational guilt over things that hawana hata control over it. Mpaka fika mahali hata unafikiria, what's the point of even being in this world? I might as well just not be here anymore. And then they might have thoughts of suicide and even have an attempt at suicide. Now that is depression. So it's not just what we use normally in normal English, kwamba mshahara umechelewa, I'm so depressed. Or alimenyeshewa kidogo, I'm so depressed. And we use the word depressed so often that it becomes so
in a loose meaning
diluted.
Yeah.
So for us, when someone is depressed, it means they are either having trouble eating, with sleeping, with focus, with thoughts about themselves. They're having low self-esteem, negative thoughts about themselves, about their tomorrow, and about their environment.
Yeah.
I am not worth it. My environment doesn't appreciate me. And even tomorrow, there's no point. It's going to be the same. So they have that constant, just negative hopelessness.
Yeah.
Yes.
In a normal setup, does a human being know when their state of mental health is shifting? Ama, can you tell? For me, naeza sema kuna this kind of gut feeling mi upata anytime niko either anxious. Definitely it follow by me having this kind of heartbeat yenye iko so pissed up. Like say it's just the normal heartbeat. It anza sa kubit like sana. Ama nanze kufeel like my insides are like zinaji kunyata hivi. Then I get to know that I'm actually getting anxious about something. So with all that is happening to me physically, it affect my cognitive. So in my mind, nitaanza sa kufeel, okay, there is something I'm anticipating. Either at that point, labda sijui ni nini I'm going to face. Ama niko very aware. Maybe niko aware I'm going to shoot an episode for a podcast. Na probably niko na stage fright or something. You see, at that point, I'm very aware that my state of mental health is shifting. So, like normally, can people know that their mental health state is shifting?
Yeah, people can tell, especially when it comes to things like anxiety and depression. Yeah, you can tell I'm just feeling tense all the time. I'm constantly worried. You already have that. But for things like now, psychosis, you don't have that. You don't, even as it's occurring, you're slowly going from who you are to now to this now current episode. You might feel different, but you really can't pinpoint what it is until it ends up to a full-blown episode now when completely you've lost inside and you don't even know you have a problem. So it's your family member to bring you in. But what you just described right now was actually anxiety. Those butterflies in your stomach, the heart beating very fast. That's more of anxiety, which anybody can be aware of when they're anxious. You know, I feel like I need to go to the toilet all the time before an exam, before an interview. So that's one, those kind of things, people are aware of them.
They are.
It's more of the more severe ones where someone is not able to actually know when it's started, when it's actually happening. Mpaka saa ikishaisha, so anasema, yeah, by the way, ilikuwa hivi. But at that time ikiwepo, hajui.
Sasa hizi disorders ambazo tunaongelelea and different kind of mental health illnesses, yeah. Sasa unajuaje pale ambapo it's a mental health issue, ama pia labda tu ni wewe mwenyewe your individual behaviors, vitu kama overthinking, vitu kama vile ambavyo unasema you're just a negative, wewe mwenyewe ndio uko negative. Where do you draw the line between something that unajua
a disorder and then just me, this is just
na
me.
wewe tu mwenyewe?
Well, people are just people. Some people are just negative. People are very happy about everything, and some things don't bother them. But inakuwa an illness once it starts impairing with your quality of life, wewe mwenyewe. Ama quality of life ya wenzako. Kwa mfano kama addiction. Wewe mwenyewe you may not see una issue, lakini wenzako wanaona at home, when you come home you're drunk, unasumbua, unapiga makelele, so ina affect au wenzako. Wewe mwenyewe hujaona kwamba inasumbua watu. So most times for you to say this is just the way he is, which pia the way he is also can also be he's been like that because he's been unwell for a long time.
Equally. Oh, that's so true.
Yes.
That's so true.
So because all of us nobody is perfect. So all of us have times when we are feeling anxious or unusually angry or unusually sad. So definitely. It's normal to have those things. But kama ikipersist kwa muda mrefu, alafu ina affect quality of life yako mwenyewe ama ya mwenzako, there might be a need to get assessed to see ni tu huaga hivyo ama there's more we can do for you.
Yeah.
And what are the ways to cope in case kuna mtu akona anxiety, akona depression, akona acute stress? What are the ways that somebody can use to cope that don't involve going to see a psychologist or a psychiatrist, maybe for the moment?
Okay. So generally, if you're feeling like you're feeling overwhelming stress, or you're feeling stressed, what do you do? So the first thing we can say to do is, what do you like to do when you're feeling stressed or you're feeling tense? People like to drink tea. I like to drink tea all the time anyway. Others like to go for a match, maybe to watch football. Others like to go and to the gym, watch a movie. I don't know. Whatever that thing is for you that makes you feel relaxed, you do that.
Okay.
Do it again and again and again and again. So ikishindikana hapo, go and see a friend, someone who you trust, maybe your best friend or your pastor or your mom or whoever it is that who you trust, who you can bounce off ideas that, hey, I'm feeling like this na imekataa kupungua. Yeah. Haya. See her or him mara kadhaa. Sasa beyond that, ambayo ina persist, see a professional. Okay. The same way if you have headache kila wakati, umeza mara moja. Imekataa. Umekunywa chai, umekunywa maji, fanya mazoezi, umetembea, umerelax, imekataa. You go see a doctor because maybe it could be something else that is just not a headache.
Hata kwa hiyo mara moja kwa the package anakuanga ameandika if symptoms persist, seek medical advice.
Yeah.
So
let me ask, before we started shooting, I asked about, we were asking you if you've done panels before, and you said, you've talked to people, you've answered questions in an audience. And for example, for me, I have such opportunities, but the first few minutes, always anxiety kicks in, and it's anxiety that I don't have control over. So there are coping mechanisms that I've learned throughout to just help calm the situation down at the moment. And you're telling me, why do that when you can just have a pill to calm the situation? And I was surprised that there is a pill you can take and it calms your heart rate, the sweatiness you're feeling at the moment, the shakiness. So at what point, Amma, how do you level the anxiety, like look at the levels of anxiety for you to be like, okay, sasa this yours, it's not persistent, ama it's not that it's occurring at times that it should not, but the way it's occurring, it's like really intense that you have to pop a pill to relax the situation.
Yeah. Okay. Put me on the spot there. But anyway, so yeah, having public speaking is one of the it's the number one thing that people are afraid of in the whole world. I think it's the number one on the list of things people are afraid of. The first thing is public speaking. So it's normal for someone to have the anxiety before speaking in an audience of people that you don't know, because it may go either way. It may either go well or may go bad. Yeah? So it's normal to have that. And it occurring in the first few minutes, also it's normal for it to occur for those first, before sasa ndo uzoe your audience, inachukua muda. Lakini kama ina persist the entire 1 hour, 1.5 hours unafanya hiyo speech yako, bado unatetemeka, bado you're sweating, your voice keeps shaking the entire time, you might need to see someone about it, perhaps to see. And that person can also be a therapist to find out ilianzia wapi, what happened at some point, sasa ikawa this is your normal, yeah. And then through behavioral training, they can find ways of helping you so that next time, but like even before you go to the tablet, you can find ways of coping with whatever happened that time that led you to think that each time ukifanya public speaking itakuwa vile. Yeah, so that's one thing. So once that, if that ikishindikana, I mean, or if it takes some time, then also you can see a psychiatrist about getting medication for that sort of stage fright, because yes, there's these meds that can help with that. But of course, we wouldn't say just go about taking pills all the time. But yeah, unadawa, once you're assessed, it can be given and it can help.
Is that pill over the counter? That pill?
Anyhow, yeah, it can be. Obviously, I wouldn't advocate for someone to buy medication without a doctor's
prescription. Yeah.
Yes, because also it may work for me, it may work for you, but what is your profile, your patient profile? Because you might have other things that you're also taking meds for that may not work for this particular drug I'm giving you. So you also have to know what is your age, what are your other things you're taking, other meds you're on, before someone can prescribe you any medication. So over the counter, ideally, should be left for painkillers, ideally, and cough medication. For other medications, yeah, get assessed, and then if it works for you, then get prescribed medication.
Okay.
Would you shine more light on ADHD and things like OCD as well?
Yeah. So ADHD, attention deficit hyperactivity disorder, is a condition that we call neurodevelopmental, meaning from utero, from how you're born, you're already born with it. You're born, age 0, you already had it. Yeah. So you cannot acquire it later on in life the way someone can be born what we call, I guess, normal, typical, and then baadaye akadevelop depression, baadaye akadevelop OCD. So here ADHD tayari uko nayo. It may not be diagnosed for many years. It doesn't mean it wasn't there. It just means it wasn't diagnosed because perhaps you never saw a doctor, it wasn't that bad, or you found ways of coping. So hata miaka hii yote 20 ama 18 years umekuwa sawa, lakini wewe mwenyewe unajua kwamba you've been struggling, lakini wenzako they just see you coping and everything is fine, but hawajui kwamba mwenyewe you've done things within yourself kujisaidia all these years. That's ADHD. So it's characterized by having issues with attention, or rather being inattentive, having trouble with focus, with concentrating, being hyperactive, being impulsive. And so the two kinds is either you have the inattentive one predominantly, or the hyperactive impulsive one predominantly, but most commonly people have the combined type. Yes. Many times it was known mostly for boys, because boys would present with the hyperactive impulsive kind. That small boy in your class when you're primary school who would always be everywhere. Like kila saa anaambia na mwalimu, Michael, calm down. Michael, shuka huko. Michael, njoo huko. Michael, sit here. Michael, where is your book? Every time ni Michael. In that kind of boys. But even girls can have it. Just that for girls, because of how our culture is, tumezoea msichana anakaa, msichana anatulia, msichana hana mambo mengi, yani unakaa tunatulia, just do your homework, nenda nyumbani, come safi, So most times culturally we end up being a girl who is just, you look well, you look presentable, but within you're struggling, but no one knows this mpaka baadaye. Yeah. So that's ADHD. So OCD now is obsessive compulsive disorder. Normally, you're not born with it. It occurs. It can occur at any. It can manifest at any time. So either you're teens, 20s, 30s, 40s, whichever age. So the picture there is somebody has obsessions, which are now thoughts in the head about maybe cleanliness, like or contamination or lights, kuzimata. So the thought is here, I need to switch off the lights, I need to switch off the lights. So for me to ease the tension within myself, nazima nawasha. So you have obsessive thoughts, and then you are compelled to have an action to relieve that tension of that thought.
Hiyo kuzimata, is that
Kidogo
all
tu.
our parents then?
So hiyo
Ni ile ya
hiyo ilikuwa ya
nani
uchumi.
amesha yote ni hivyo?
Hiyo ilikuwa ya uchumi, sio hiyo. Hiyo ilikuwa ya uchumi.
Hiyo ni ya hela.
Hiyo ni ya hela. Hii nyingine sasa ni yani you're doing it because in your head you have this obsession kwamba if I don't switch off the lights 3 times or 9 times or 6 times or 12 times, a particular set of numbers, something bad can happen to me or to my loved one or to my environment. So nafanya hivyo mara 12 mara 9 so I can feel less tense but only temporarily. After tena narudi baada ya muda. Something like that. Ama kama ni kunawa mikono kama nini.
Wacha nikupatie just a minor scenario. Uniambie if it qualifies to be under OCD. Kuna this kind of situation whereby if you want to like unpack things, unaona tuseme umebuy like mchele, nini, you have to put them in specific containers. Ivo, like if you want sijui a room ikuwe na specific colors, it's not a matter of when you will explain you have to like be switching on and off lights for like a set number of times. Mi nimekuwa associate OCD na being a neat freak. You just want things done in a certain way, and if somebody comes in does the thing differently from vile wewe umezoea, inakusumbua.
Yeah, well, yeah. So in OCD they have their way of doing things, and if they arrange their flowers in a particular way and then they find umetoa, it does irritate them because in their mind it's causing them to feel anxiety.
Yeah.
It's causing them to feel tense. So yeah, but if you're just orderly, you like your things, your kitchen white with your containers a particular way, and your rice is in labeled and it's in pink and all that. That's just you like nice things. Yeah, you like order.
Okay.
Yeah.
Haya, so as you're winding up, maybe I'd like to ask this question to all of us. What is something you wish you knew about mental health when you were younger? Sai hivi tukwa kubwa na hivi tushapata a lot of insights from our expert hapa. But what is something ungependa you wish you knew when you were that a young person? Tuanzie na nani? Merlyne.
So I think it's what we said before. Associating mental health with, let me just say it, mwenda wazimu. It's like that is all we knew, like ule. And then now growing up, getting that term and knowing that it's a disorder, like the only thing was that, like mwenda wazimu. And then the umechizi madhare thing. Yeah, that is all that was associated, like all information packaged. That is what is mental health. Yeah.
I feel like I associate with the same sentiments. For me, about autism, we had an autistic classmate nikiwa lower primary, and then definitely alikuwa slow and everything like that. Then I used to be kwa ile kategoria si ndo tunashika vitu haraka, you get. So tuko tunaelewa like why the teacher would pause, anze kushinda akipeleka mtu through something that seemed so easy, you get. We didn't have that grace. We were not extending that grace. We were never patient. Tulikuwa tunashanga guy hadi kuhesabu like 2+2 inampatia shida, you see. So I feel like if at all at that point tungekuwa tunajua kuna people who are born like this, na tusikuwe na hiyo hint of either judgment ama tuko like kwani huyu, like you get. So I feel like we as kids ama I as a kid would have extended more grace to my fellow classmates, especially to do with things kuhusiana na autistic people. Yeah. Aisha?
I think it's just lack of awareness, and I don't think vitu zilikuwa they defined these things back in the day. However, to some element ama to some extent, kwa sababu my mom is a nurse, so kuna vitu angekuja angeniambia, so that is how I got exposed to, you know, certain medical words for, you know, different mental illnesses, yeah. So angekuja huu ni mgonjwa kuna hii na hii, kuna hii. So that is the only awareness like I would get. Lakini kuangalia katika environment especially yetu ya Kiswahili, utajua mwezi uko full, kwa hivyo ashalepuka huyo. You get like you know how the community normally is. And I'm glad naweza kusema like with such platforms kama yetu space yako, the podcast, you know, we get to have these particular conversations, because with time kama vile tu Merlyne when he started it said the M word ambao ndio hiyo umesema mwendazimu, but these are terms that have been used over and over again mpaka sasa hata despite the knowledge tuambia unasema kuna anxiety ama ni bangi tu umevuta uko na wasiwasi ama ni jaba umekula. So it's just more conversations to create more awareness. And I don't know if they take it seriously nowadays in schools, kwa sababu we would have like an office for guidance and counseling, but I don't think mtu hata ungeenda, because it's that teacher who angekufundisha history ndo bado unataka kwenda hapo, ama CRE, mostly ilikuwa CRE teachers. Ukweli, alafu ati sasa uko na issue uko ndo unataka kwenda for counseling. It becomes difficult to open up to that teacher, because then this is the same teacher you're going to find in class. Yeah, really? Yeah. So it's just more conversations for more awareness and using the right terms, and not also being scared to reach out to your friends. Kama unaona, okay, I think nilikuwa hivi lakini sasa niko hivi, let me reach out to someone else, nijue kama have you noticed like any changes in me. And then of course seek medical help as well. And sasa sisi when you start kuna watoto tukuwaongelesha and just create that awareness from just the onset.
Maybe to Dr. Malaika yako itakuwa a different question, a parting shot to our audience. Labda unaweza ambia the youth watching us ama each and everybody who's watching us the importance of seeking professional help in terms of in case somebody is facing anxiety or depression or any kind of mental health issue or condition.
And tied to that, we will also want to know what age brackets you deal with, how young and how old, as a psychiatrist, and also us as Gen Zs or millennials, what is some of the mental health issues that most, I don't want to say most of us have and have not been diagnosed, but from the patients that you've handled, what is the mental health issue that affect us most, that age category?
Yeah, okay. So many questions. So I think a lot of psychiatrists see a lot of anxiety, depression, and addiction in the young people. I see a lot of addiction in young people, especially in men, young men. And many times for men, a man would present with addiction as what we are seeing, but actually what is behind it most times it's either anxiety, depression, or even ADHD. So, and then of course ADHD is often not diagnosed in time in childhood. So many adults or young adults are out here with ADHD that's undiagnosed, and they're struggling with anxiety, depression, and substance use. So quite frequently I see a lot of anxiety, depression, women and girls, and then substance use, alcohol and weed, a lot of weed and alcohol in men, in young men. Yeah. So the same way we said, if someone has a persistent headache, a persistent your leg is persistently paining, or stomach ache, you would not sit in the house for months waiting for taking mara moja too. You go and see a doctor. If you had fevers that are not relenting, you go and see a doctor. Same thing with mental health. The only thing about mental health is that because of the stigma, many people will not show up, will not come and get help, because they feel like, especially if they are young men, that they'll be seen to be weak, or they'll be seen to be not able to manage. How does a man go and see a therapist? You know, such kind of what the society has normalized, that men should not be going to get help because of, kuongea tu na msee, as you unataka tu kuongea na msee, basi ongea na beshte yako. It's not as simple as just talking to your friend. Yeah, so if something is troubling you, if it's stress at work, at home, there's help out there. And if it gets to a point where you're having thoughts of suicide, or even the idea of a suicidal thought, it should be a wake-up call that you need to get help immediately. So what I do see commonly is young people from the ages of 16, 15, all the way to adults, not adults, to people, not people, to autism, as in adults, yes. So as 60, 70s, yeah. So I see that's the group I see, 15 and above.
I have one last thing. There's something I got to learn. There's presenting symptoms, and then there's the disorder itself. So someone might be having depression, but they're presenting symptoms of... Okay, that's a bad one. But someone might be presenting symptoms but not having that disorder per se. And that is why I wanted to go back to what Gladwell was asking, if she can diagnose herself, so that we tell the audience it's really important to see a professional, because you might get those over-the-counter medicines for presenting symptoms of a disorder that someone doesn't have. Yeah.
Okay. So presenting symptoms are what I feel. I feel sad. I feel irritable. I'm sleeping poorly. I am not eating well. I'm unable to focus. These are symptoms that I'm telling someone. Yeah. Now, all that can either be depression, it can be anxiety, it can be dyslexia. It could be really many things. So someone needs to tease out and see, okay, you're not sleeping well, but is it all the time? Is it sometimes? Are you not eating well? Is it during your period? Is it after your period? So there are many things that can just seem like sikuli vizuri, but kwa nini? What is the context around it? That's what the doctor does, or the professional does, is to tease out and see, is it just all the time? Is it because of this thing happened? Is it because of your period? Is it because of time of the month? There are many things that go around a symptom, and if it keeps recurring, then maybe it's a problem. And also over-the-counter medication, for example, if you might think you have depression, maybe it's bipolar, then you go and get yourself an antidepressant, which makes bipolar, which is not given for bipolar 1, for example, and makes bipolar even worse, So also it's not good to go and just buy over the counter, because it might affect how eventually you present to the doctor eventually. Yeah. So it's good to have information. It's good to be empowered. That's very good, because a lot of the people in this current generation are really empowered. Millennials, Gen Zs are well, because we have internet, we have access to all manner of information. Compared to now, how we were raised and how our parents were raised, they didn't have this much information available to them. But that also may not be a good thing, because if you now start saying, sasa na dawa hii, Google the symptoms, and then you're seeing this, and then you're saying iko na hii, and then you don't take the medication. So knowledge also has to be good, but also how we use it also can make us either take medication, not take medication, go for help or not go for help, or go there and start telling the doctor, I have this, I want this, which can't work.
Yeah. Wow. So this was a thought-provoking conversation. I hope mmepata a lot of takeaways from whatever we've had today. And maybe you could maybe shout out your socials in case somebody wants to probably reach out at a personal level. Because tumwambia the physical location you're at is at Kaya Nairobi, your hospital. Kindly just shout out your socials and everything.
Great, yeah. So I have a practice at along Langata Road at Tranquil Med Center on Langata North Road. My socials are Kenyan Psychiatrist on Facebook, on Instagram, it's Dr. Malaika Menju. Yeah, basically Instagram and Facebook. Space. Also Dr. Malaika on X. Yeah. So yeah, Malaika everywhere.
Dr. Malaika everywhere. So guys, thank you so much for tuning in. Remember to use our website, Wazzii, wazzii.ke in case of any queries. I hope you have learnt a lot, and see you next time. Bye.
Bye guys.